Welcome to Getting to the Root Cause with Dr. Fong. I'm Dr. Fong, and I'm a naturopathic doctor. And, if you guys don't know what a naturopathic doctor is, what I'd like to do is explain my profession with a really great analogy that I picked up when I was in med school. So let's say you're driving around your car and the check engine light comes on. And you take your car to the mechanic, and what does the mechanic do, right? The mechanic will open the hood, check the engine, get under the car, and really get to the root cause of what's going on with the engine in order to fix the engine so that check engine light goes off. So I like to use this analogy to explain what I do as a naturopathic doctor. I will open your hood, check your engine, get to the root cause of what is causing your symptoms, your disease, your imbalance, to really treat that root cause of the problem. So that is why I have called this podcast Getting to the Root Cause. And that is my goal with this podcast. I don't want to just tell you what medications to take or what medical interventions to do in order to treat your symptoms. I really want to give you the knowledge and the power to really understand what the root cause of your problems might be, and then treat those root cause problems so that you can optimize your health for decades to come. All right, so I will be using my clinical knowledge as a naturopathic doctor. I will be drawing upon the clinical research studies that back these naturopathic modalities and principles that I'll be talking about. And I will be having some really great experts that I will be interviewing to help you understand the root causes of your problems. Okay, let's deal with some housekeeping items first. So this podcast will also be on YouTube, so you can watch me if you would prefer to listen to this podcast that way. I will be sometimes showing some things that might be helpful through video. So you can access it on YouTube. And there will also be a written blog that you can find at naturalstartmedicine.com/blog. And in that blog, I will be writing, more in-depth information about some of the things I mentioned in this podcast. And also the different studies will be there, the studies that back up the information I'll be talking about on the podcast. All right, so let's get started with today's episode. I'm really excited about the episode because, it's the new year and 2020 is coming. And a lot of people have been asking me, what are the top tips that, that I really suggest that will help people maintain their health. And I think it's a great time to talk about this. So this podcast, this episode is about the top 7 health hacks that I suggest to optimize your health this year. And, there are some things that we all know, and I'm sure if you found my podcast that you should be eating organic, non-GMO, you should be de-stressing, exercising, doing things like getting a lot of sleep and drinking a lot of water, getting out in the sun. So I'm not going to mention those today in my top 7 health hacks. What I would like to mention are the things that most people don't know. And what I find is that when I tell people these health hacks, they usually say, wow, I didn't know that. And since I've been doing it, it has really helped my life and I feel so much different. And what I love about these health hacks is most of them are really easy to do. They're things that you can do on a daily basis, and most of them are part of what I like to call the magic morning. And they're just really great things you can do first thing in the morning, and they will help you stay healthy and maintain that health. Okay, so let's get started. In my practice, the way that I want to talk about these health hacks is, all of them are going to be about one subject. And that's because in my practice, I treat really chronic, complex diseases. And those diseases include things like autoimmune disease, chronic fatigue syndrome, fibromyalgia. And what I've really found is that these chronic illnesses are really due to one thing, and that is toxic overload. And I like to use this idea of a detox funnel. And the detox funnel is my analogy of your liver, your gallbladder, all your detox pathways. And what happens is that this funnel will get full over time, okay? And now this detox funnel, what does it metabolize? It metabolizes fat, toxins, hormones, and over time it will get congested, and it empties out into your colon, going out the body as stool. It empties out into your kidneys and your bladder, going out the body via urine, and it also goes out via your skin. So, sweating, etc. That's how you release the toxins in that manner. And this has really become the basis of what I do with almost every patient, is identifying what is filling the funnel. Is it food? Is it toxins? Is it microbes? What's filling the funnel? I identify, are the exits working? Are you going to the bathroom every day? Are you urinating well? Are you sweating? Are you exercising? Are you moving your lymphatic system? And then what I do is I will optimize all those functions. I'll optimize getting those things out of the body. We will take away those stressors that are filling the funnel, and we will flush that funnel out. Okay, so that's really what I have found as the magic bullet in my practice. And so when we talk about these top 7 health hacks, a lot of them are going to have to do with detoxification. If you keep yourself clean, then you will be healthy. Again, we go back to that car analogy, right? If you never flushed out your transmission fluid, if you just drove your car and you never took it to the mechanic and you never flushed out your transmission fluid, never changed your oil, your car would eventually break down. And I think this is one of the problems. Our doctors aren't teaching us how to maintain our cars by flushing out our fluids, by cleaning our system, by not putting bad oil and bad gas into our cars or our bodies. And so that is what I like to teach my patients, and that is what we are going to talk about with our top 7 health hacks. So let's start with number 1. Number 1 is something super easy to do, and it is something that you can do first thing in the morning, and it is called dry brushing. And dry brushing is exactly what it sounds like. You're going to take a dry brush, and if you're on the video, it looks like this. And you are going to start at the bottom of your body, at your feet, and you basically just brush your skin, and you just brush it towards your heart. And so you'll start at the bottom, and you'll go with 10 strokes towards the heart in every area. And what that does is it really stimulates the lymphatic system to move. And what is the lymphatic system? The lymphatic system is a network of vessels and lymph nodes. And what it does is it carries something called lymph. And what that lymph does is it is our immune system, and it protects our system from it. It mounts an immune defense against microbes and toxins. And so that's why when you get a sore throat, or let's say you have strep throat, your lymph nodes in your neck will swell up because the lymphatic system is activating and causing an immune response to happen. So sometimes this lymphatic system gets congested, especially if we're not exercising and not working out. This system will get congested. So this is something super simple to do. And not only that, it feels really great. And you end up with exfoliated skin. You end up with moving that lymphatic system so that the toxins aren't just lingering around. I remember when I had really bad eczema. So I became a naturopathic doctor because I had super bad eczema all over my body. And I remember when I had really bad eczema, the eczema would be mostly in my joint areas where I had a lot of lymph nodes, and I would scratch and scratch and scratch. And what I was really doing, what I realize now, is that I was trying to move my lymphatic system, and that's what the body's trying to do. So most of the time when you have symptoms, it's an alarm system. It's the body saying, hey, something is wrong. And what you will do to try to fix that is usually trying to fix the problem. So I remember when I would scratch and I would try to move that lymphatic system. And so, that is really showing you that, any kind of skin conditions, even if you have like neck pain, joint pains, that can also be a problem with the lymphatic system being congested. Okay, so that moves us on to number 2 on my list, which is doing contrast showers, which are hot, cold showers. And this is really nothing new. The Romans were doing this, way back when. And the idea is that you want to get the blood flowing with the warm or hot water, since the warm temperatures will open up those blood vessels and flush the body with blood. And then when you switch to cold, it drives the blood inward, and it really protects the organs from the cold. And it really has this flushing action that starts to occur. And that flushing action is detoxifying, it's stimulating for the organs. It's really one of the easiest things you can do as well first thing in the morning after you've done your dry brushing. Then you get in the shower and you do your hot cold showers. Now you want to keep in mind there's this ratio of 3-to-1. And so you want the hot water to be 3 times as long as the cold water. So if you do, let's say, 3 minutes of hot water, then you want to do 1 minute of cold water. If you do 6 minutes of hot, do 2 minutes of cold, or 90 seconds of hot, followed by 30 seconds of cold. And so when you first start doing something like 6 minutes of hot water and 2 minutes of cold might be a little long. So you can start off with a shorter amount of time, but always remember to use that ratio of 3-to-1. Now, you don't want to just do it once. In your morning shower, you want to do it about 3 to 4 times, and you always want to end in cold. And not only that, this is so stimulating first thing in the morning. When I do these in the morning, I just feel like I'm ready to go and ready to take on the day. All right. Number 3 is another thing I love to do in the morning, which is called sun salutations. And sun salutations are a sequence of postures. They're yoga postures that are done, and they're supposed to be done. They're called sun salutations because you are supposed to face the direction of the sun, and you usually do them at dawn or at sunset. Now, both of those things are not necessary to get the benefits of sun salutation, so you can definitely do them inside, in your home, and they can be done any time of the day. But as I said, I love to do them first thing in the morning. And I will be posting a little information about this again on the written blog. So if you want to go there, you can see some more information on this. But there's so many benefits. It strengthens the digestive system. Again, the lymphatic system really gets moving when you do these sun salutations as well too. It restores the nervous system. When you do the sun salutations, I also really like you to do some deep breathing. So you're going to get a meditative benefits out of this too. You're stretching your limbs, you're stretching your back. A lot of my patients will say that aches and joint aches and pains, they tend to go away after doing these for, every morning for a whole week. And then if they stop doing it, those aches and pains come back. I find that they also just really relax the system. So a lot of patients with anxiety, if they do these first thing in the morning, the anxiety levels can really come down as well too. So you want to practice this every day if you can. And I tend to do about 4 sequences of the sun salutation. It really only takes me about 5 to 15 minutes. So it's really not a big part of your day. And again, the benefits are just, so huge that I really think it's a great thing to add to your morning ritual. Okay, the next thing that you can do is another thing you can do in the morning, and it's called oil pulling. And oil pulling is a really age-old remedy, and it comes from Ayurveda, which is a type of Indian medicine, and it uses oils to pull out toxins from the mouth, and then you swish them around, the oil around for about 20 minutes, and then you spit it out. There's a really great thing that lipids or fat does. Fat really loves to grab onto toxins, and that's something that not only happens with the fat that we swish around in our mouth if we're doing oil pulling, but we should know that fat also grabs onto toxins, the fat in our body. And fat really acts as a really great insulator to protect the rest of our organs from toxicity. So when we swish around fat or oil in our mouth, the oil tends to grab to those toxins and microbes, and then when we spit it out, it'll get all those toxins out of our body. I've really found, especially in the last, let's say, year or two, that dental toxins are a huge part of chronic illness. So if you have root canals, if you have wisdom teeth extraction, you might have something called a cavitation where the bone didn't heal properly and microbes might be growing in that cavitation. If you have amalgam fillings, there's a lot of dental toxins that we might have after getting dental work done. And so first of all, I highly suggest, just as a side note, I highly suggest you find a biological dentist. Biological dentists will be kind of like naturopathic doctors. They tend to look at the whole system rather than just treating your teeth. The other thing is that if you have any of these things I mentioned, you might want to reach out to a biological dentist and see if you can address these items like root canals and things like that. There's a really great documentary called Root Cause, which I think might still be able to be watched on YouTube. And that will tell you about some of the dental toxicities that cause problems. So going back to the oil pulling, what you want to do is use, so traditionally sesame oil is used, but you can use oils like sesame, sunflower, or coconut oil. And you want to do about 1 to 2 teaspoons of these oils, of one of these oils, and you swish it around in your mouth, and you do that for about 20 minutes. I tend to do this while I'm showering. You can start off at about 5 minutes because sometimes 20 minutes is quite a bit of time for someone who's first starting to do this. But you want to get up to that 20-minute time frame. You want to swish around in your mouth, and you don't want to swallow because now that those oils are bound to toxins. So you want to make sure to spit that out, and don't spit it out in your sink or in the shower just because it might clog your drain. So I usually just, as I'm getting out of the shower, I'll spit it out into the trash can. And this will really, it whitens teeth, it stimulates detoxification of the oral toxins. And as I said, those oral toxins can cause a problem in overall health and chronic illness. So this is a really important one. Again, super easy to do. Okay, so, those 4 items are really important in terms of, what can you do first thing in the morning on a daily basis to maintain your health. And if you do those 4 things, you're doing pretty good. And again, those things probably take, a total of, 20 to 30 minutes. And you can even be doing them as you're showering and as you're getting ready to go. All right. This next item is called intermittent fasting. And this is something that I learned from a professor of mine, Dr. Andre Sain. And he, I actually had a scholarship to study with him. And he's a really great homeopath. And one of the things he taught me was about intermittent fasting because it's something he does himself. And what intermittent fasting is fasting for certain periods of time. And the type of intermittent fasting that I do myself and I suggest to most of my patients is a 16-8 fast, which means you will fast for 16 hours of the day and then you will eat for 8 hours of the day. And the studies show that intermittent fasting stabilizes blood sugar, increases resistance to stress, suppresses inflammation, decreases blood pressure, cholesterol levels, improves brain health, and increases memory. And so there are studies that show that intermittent fasting is beneficial, and you can do it in so many different ways. But again, I like the 16-8 type of fast. It takes about 10 to 12 hours for the liver to use up the energy stores. And so after that time, the body then starts using your own body fat to create energy in the body. And so there are 2 great things that happen here, right? One, you're going to lose weight if that's something that you're trying to do, or you're going to maintain a really good weight level because you are just going to be eating away at any excess fat that you have. So I usually say do a pinch test. If you have 1 inch that you can pinch, then that's 1 inch or more, then that's too much. Doing something like intermittent fasting can get rid of that excess fat. The other thing that's beneficial is the thing that I was talking about earlier, that fat grabs onto toxins and really acts as an insulator or protector in our system to protect us from the toxicity so that those toxins don't circulate and go to our organs to cause more damage. So when you are eating away at the fat with intermittent fasting, the toxins will also be released through the system. So when you skip breakfast, I highly suggest that you drink a lot of fluid so that you're flushing out all these toxins from the system. I also suggest that you could do something like a detox broth or a detox tea. If you want to really do intermittent fasting, you're going to do something that doesn't have any calories, but a detox herbal tea is something that you can definitely do. Okay. So let's move on. The next thing that I would really like to talk about is something that I've learned really mostly over the course of this last year. And the reason I've learned it is, about a year ago, I went through some really serious trauma in my personal life. And, someone that I really loved really betrayed me. And so I myself was looking for some healing at that time. And I remember seeing, a therapist. And when I first saw her, she said, and she heard what had happened to me, she said, "Wow, Diane, I think you're going to need like a year to 3 years of therapy. I don't know if just a month or 2 months is really going to be enough. Like what you've gone through is pretty significant." And at that time, I agreed with her. I said, "Yeah, let's do it." I think, by some magic, somebody I had met at a conference reached out to me around that same time. And she said, "Dr. Fong, can we do a trade? I need some naturopathic support, and maybe you want to, have some exposure to this therapy called Emotion Code." And so she came in and she did Emotion Code to me, and we ended up working together for about a month and a half, and we did about 4 to 6 sessions. And this work was amazing. I mean, it's something in all my years of searching and doing therapy and all that, I have never found something that has worked so quickly and so effectively. It's figuring out what are you holding on to subconsciously and what trapped emotions and traumas are you holding on to. I like to describe these things as weights that, if a trauma happens, we create this weight and then we put it in our systems and we hold on to it, and then it drags us through life and it affects everything we do, all our decisions, and all of the processes of our body are affected by these subconscious traumas and emotions. And so with Emotion Code, you identify these emotions and traumas through muscle testing, and then you clear them. And so not only do you identify them, but you actually will clear these emotions and traumas out of your system. And so in doing that, 4 to 5 sessions, 1 to 1.5 months, I not only felt like I cleared the trauma from the episode that happened last year, but I cleared, a decades worth of trauma that I'd been holding on to. And not only that, but generational trauma that came from my mom and my dad that I'd been holding on to as well too. And after, I was completely clear, there really was a sense of lightness. Like I felt taller, and a lot of patients will say that. It's like, "Dr. Fong, after Emotion Code, I feel taller. I feel weightless almost," and happiness and satisfaction with life that I really just can't explain. And so this tip is about not holding on to emotions and really letting it go. Because in this last year, I have seen that when we hold on to emotions, it affects our health. And now, practicing Emotion Code in my own practice, what I have noticed is that the patients who are not getting better, they're doing everything they can possibly do. They're eating well, they're exercising, they're taking supplements, they're following everything I'm telling them to do from a functional perspective. If I can't get them better, there's 2 problems. One, they might have a surgery, which means that their normal healing process has been changed, and that might be something we're fighting against. But number 2 is there's usually some trauma that I'll find there. And once I had Emotion Code as something that was part of my practice and I started using it on these patients started getting better. I mean, astronomically. Like I really can't explain it, that once we cleared these traumas and these emotions from their system, their bodies just started to heal and everything started to get better. So my tip here is, if you're driving your car and someone cuts you off and you get angry, don't hold on to it, all right? As soon as it happens, just say, "I release the anger I feel for that guy and I forgive him because he's probably going through a bad day," and just let it go. Okay, so Emotion Code, I love it, and I really implemented it into my practice, and it's really been one of the best things that's happened this year. All right, number 7 on my list of top tips is to detox at least 1 to 4 times per year. And the more junk you put into your detox funnel, the more you're going to need to detox. So I tend to do a really deep detox at least 2 to 4 times per year, depending on how much I'm filling my funnel and putting junk into my system. And, even if we're living the healthiest life, as we walk around and live our lives, we are being exposed to toxins all the time. And so everybody needs to detox. Everybody needs to take their car into the mechanic at least once a year to make sure that the system is clean. So when I say a really deep detox, what do I mean? The magic bullet in my practice and for me has really become something called the liver gallbladder flush. And the liver gallbladder flush is a procedure where you are going to be doing a diet and taking a bunch of herbs and supplements to flush out the liver and the gallbladder, flush out the bile ducts, flush out the gallbladder, and all the congested bile and decades worth of toxins that are in this detox funnel. All the toxins that are in this detox funnel get flushed out of the system. And how did I discover this? Well, I myself became a naturopathic doctor because of eczema. I had really, really bad eczema. As a baby, it was so bad that my hair was falling out. And I went on a search to find solutions with naturopathic medicine, with, supplements, yoga, de-stressing, good diet. I was able to get my eczema about 75% better, but it was really frustrating me that if I went outside of my diet, if I did anything that was outside of my naturopathic protocol, my eczema would come back. So to me, that didn't really feel like I had been cured. And it really wasn't until I found the liver gallbladder flush and I did 3 of these back to back and flushed out my liver and my gallbladder and my colon that I really was eczema free, and I never have eczema anymore. And for anyone who has eczema who's listening to this, you know that once you're an eczema person, you feel like you'll always be an eczema person. And that really is not the case anymore. I do not identify as an eczema person. I never have eczema. And that's because I flushed out my funnel. So this is the deepest detox, and this is the one that I suggest that people do at least 1 to 4 times a year. If you don't know what that is, there is some information on trulytransform.com. So because this has been such a magic bullet in my practice, for my patients, for myself, I did create an online program that gives everyone access to the information that you need to complete a liver gallbladder flush. And again, that's at trulytransform.com. I will probably do a more in-depth podcast about liver gallbladder flushing, but if you want information in the meantime, you can go there. Okay. And again, I suggest you do. I always do one every January. So I am going to be doing one this coming month. And I will probably be posting it on my story as I go through the process so that you can see what it's like to go through a liver gallbladder flush. So make sure to follow me on Instagram at Dr. Fong ND. I'm sorry, drfong.nd. And that's DRF as in Frank, ONG.N as in Nancy D. And also it'll be posted on Facebook too at Diane Angela Fong ND. And the other great thing is I would love for someone to join me on this. Actually, I'd love for all of you to join me on this process. But one person I am going to do a giveaway for. And so if you follow me on Instagram or Facebook, we will be posting right after we release this episode. We will be posting a post that will give you all the information for the giveaway. I'm going to be giving away one of those Truly Transform programs. So follow me and join my giveaway if you can. Okay. Well, thank you so much for joining me today. It's been really fun. Remember, this podcast is also on YouTube if you'd like to watch it. There's also a written blog that's on naturalstartmedicine.com/blog. Natural Start Medicine is the name of my practice, so that's also my practice's website. And the links for the products and the websites I suggested in this episode can be found in the description for the podcast. And, please follow me on Instagram, again, at drfong.nd, and on Facebook at Diane Angela Fong ND. And subscribe to this podcast. We're going to be doing some really great things, and I'm just going to be trying to give you all the health hacks that you need to optimize your health. I'm also going to be interviewing some really great experts, and we're going to be chatting and talking about all those health hacks that you need to optimize your health. And please comment. Let me know what what you want me to talk about. Comment and let me know. And, it's been really great chatting with you. And I'll see you next time on Getting to the Root Cause with Dr. Fong.